Okay, here we go.
Thank you for joining us for Health Equity for Alzheimer Dementia Patients. We'll be getting started in just a moment. Thank you for joining us. This is the Greater New Haven Chamber of Commerce and Quinnipiac Chamber of Commerce. My name is Garrett Sheehan. Today, our topic is health equity for Alzheimer and dementia patients, eliminating disparities and addressing social determinants of health. Very glad you could join us for the program we have today. Want to first thank all of our investors in the chamber who allow us to put on this programming that you're either watching live or on demand. You can see all of our investors scrolling across the screen. It's only with their support that we are able to put on programming like this and many other webinars, which you can access on our YouTube channel. We also want to thank our Healthcare and Life Sciences Council and our presenting sponsor of the council, Harvard Pilgrim Healthcare. Thank you for all of your assistance putting on these programs. Now, to get us started, we'd like to welcome in Andy Orefici, Program Coordinator and Community and Government Relations for Yale New Haven Health. Andy?
Hey, good morning, Garrett, and thank you everyone for joining us today on behalf of the Healthcare and Life Sciences Council, where I serve as chair. Especially thankful to our friends at the Alzheimer's Association and at Harvard Pilgrim for this important discussion that you're joining us today on equity and memory care. It's a topic that hits close to home with me, and I know all too many people. So thank you for spending your time with us today, and Garrett, appreciate you emceeing this.
Thank you, Andy, and we appreciate all the support from the council and also from Yale New Haven Health. Let's get right into our topic today. We are going to start off by talking about what does Alzheimer's mean for the workplace, and just a few stats that you can see up here. It is something that impacts business every day, not only the patients who come down with Alzheimer's, but also the family members. So I'm going to start to bring in our two panelists that we have with us, and we'll start to have this conversation about things you need to know about things that maybe your employees are going through, your coworkers, not just if they're suffering from Alzheimer's, but the family and caregivers as well. So let me now welcome in our first panelist, Claire Levesque. She's the Chief Medical Officer for Commercial Products with Point32 Health and Harvard Pilgrim. Claire, thanks so much for joining us. We appreciate you being with us. Claire, I'll let you get started. I know you have a personal story in connection with Alzheimer's, and it also goes to dealing with family medical leave and being able to take that time to support a family member.
Thank you so much, and it's a pleasure to be here, and it's also a great pleasure to be on a panel with the Alzheimer's Association, since they are such strong supports for everybody who's dealing with this disease. So for me, I'm a neurologist, and I cared for a lot of individuals with dementia and Alzheimer's disease in my practice. I actually did research, both laboratory research and clinical research on Alzheimer's disease. Unfortunately, my personal story is that my husband died just before the pandemic from Alzheimer's disease. And that's what I'm going to focus on the most here, because I think this is very relevant for all of you as you look at how you support your employees. So Bill was probably about 60 when he first started to develop the symptoms. The symptoms are hard in the beginning. He was always a perfectionist, and he would come home and he'd say to me that he wasn't sure he was keeping up at work. And I wasn't sure that this was really a big deal, because he always wanted to excel. And then things went on and he had to quit working. In the early years, this was not a big deal. He stayed home. He seemed to develop a good routine about taking care of a lot of things on the home front. And we still were able to do a lot of things, go on vacations together, have a lot of good times. But as things progressed, it became more complicated. And one of the things that people don't always recognize about Alzheimer's disease is the whole issue that the decline isn't just this nice smooth thing and you can predict when it's going to happen. So when you have to have somebody stop driving, doesn't just suddenly happen one morning and you know it. When somebody starts to wander is not something that you can predict. And so because of that, individuals who are supporting a family member with Alzheimer's disease really need access to FMLA, but they also need access to it in a fashion that may be somewhat intermittent. So, on the day that my husband, who had never wandered, and we had a part-time companion and it all seemed to be going well, the part-time companion had lunch with him and then said, "Oh, you're out of bread." And next thing that happened was the companion left and my husband went off to the grocery store, very confused and having to be brought back to the home by the police. Something that would have been very hard for me to predict, but of course it suddenly meant that I needed to take some time off of work to find better supports for him in the home. And so these sorts of things come up at times that are not easy to predict, and that the person who's going through it needs to feel comfortable sharing with their boss and with their employer about what's going on. The other thing that I talk about a lot when I discuss this with folks is what I call the list phenomena. So, when you're a caregiver, everybody gives you lists. One of the lists I remember receiving was, when we were worried about the wandering with my husband, could I get him a watch that had a GPS in it? And so I got a list of 10 companies that provide these, 7 of which turned out to be out of business. And then I finally found a company in Canada, of all places, that could do this. So the work to doing all of this is a lot to put on caregivers. It also means the caregivers are sometimes not necessarily able to fully concentrate on their work. And right before we all joined here, we were all talking about multitasking, those of us on the panel. And it is very difficult for somebody to feel that part of their brain is thinking about, is their loved one doing okay at home, while they're also trying to get their work done. Another thing that I was lucky enough to have was that we have a support group that we formed at work, and it's called the Caring and Sharing Group. And this is a support group specifically for caregivers of adult loved ones. So it's not specifically around dementia, but it still has been very helpful to us. And one of the things the support group has done is sort of a mix of just general support for each other, talking things through, giving suggestions, but also even having folks from HR come and talk to us about, what does FMLA mean? What do we have available to us? What are the other things that we can look to help us understand how we can do well as a caregiver and as an employee? I was also lucky enough to be in a company that had a dementia specialist sponsored through a cooperative agreement with the Alzheimer's Association. So when I needed some help, I could actually go to the dementia specialist and say, this is the thing that I'm dealing with. What do you suggest? Who should I go to? What's the next level of services that are needed? And I think that's critically important. So finding ways that you can support these employees so that they can do what they really want to do, which is do well as an employee, but also do well as a caregiver. And I'm going to turn it over to Kristen to talk a little bit about some of the things that the Alzheimer's Association can do for your employer groups.
Thanks, Claire. Really appreciate you sharing your personal story. And so I will bring in now Kristen Cusato, Communications Director for the Connecticut chapter of the Alzheimer's Association and a research champion for New England. And Kristen, we've been speaking with you over the last several years, and I know with the Alzheimer's Association being part of the chamber, we're always trying to get that messaging out. Share with us a little bit about the statistics that impact people with Alzheimer's and some of the resources that are out there as well.
Excellent. Thank you, Garrett, and thank you, Claire, and thank you, everyone, for having me here today. Yeah, I mean, the biggest thing that we want is to not hear anyone else say, gosh, I wish I knew about you guys then when I was taking care of my mom, husband, wife, whatever. So we're really trying to spread the word of the awareness and of the services that we do have available. We are a nonprofit organization, and we do things that Claire was mentioning. We have a helpline, an 800 number, and if somebody wanted to maybe potentially put that in the chat, that'd be great. It's 800-272-3900. And that number you can call anytime, day or night, with any question about dementia. And in fact, we encourage people to call that when they first get a diagnosis, because we can set you up for that individual dementia care specialist that Claire was mentioning, a care consultation to help guide you. When families get hit with this disease, it's like getting hit with a truck, and then you have to put it all back together and you don't even know where to start. So a care consultant can help guide you through the process and say, okay, here's a support group, here's a class to take. Yep, that number, and any of the attendees can put it in. Again, that is 800-272-3900. Thank you, Tamika, appreciate it. So this is really for, anybody who has any questions, and you can even call and say, hey, I need a neurologist in New Haven. Here's a list. Or, hey, my husband just walked out the front door and I need to distract him and get him back in here. What do I do? What do I say? It's 3 a.m. So this is a really wonderful resource that we have. And we also have, the resources on the ground, right? We have people who are out and, well, now it's virtual, right? We did pivot to virtual last year, but doing all these classes online. So you can learn, what are the 10 signs? What are some of the things that we need to be concerned about? What do I look for in my loved one or myself? What are the legal and financial plans that I have to go through when I first get involved in this disease? What is later on down the line? How do I effectively communicate? What are some of those tips and tricks for communicating with someone whose brain is changing, and whose early memories, recent memories are lost? So we have all sorts of classes to get involved in. We do have 90 support groups that are mostly, again, virtual right now. And support groups for people with the disease, support groups for spouses, support groups for adult children. We have groups for early stage, meaning if you're earlier in the diagnosis, we have things to keep you engaged, because we know so much about how it's really important for cognitive and social stimulation. So we have museum programs for those in the early stage. We have gentle movement. We have singing groups. So we have all sorts of things for those in the early stage as well to kind of keep them and the caregivers engaged. We also have a very robust advocacy program, and I know you guys are involved in various things like that. So talking about different policies and how to really get folks involved in what's going on the local level, as far as folks up in Hartford, but also on the national level with our lawmakers. And we also, to pay for all that, right? Because that's all, thanks to raising money. We'll talk a little bit more about our Walk to End Alzheimer's and our other events that we have. But just to chat with you, I wanted to talk about, that we threw up that stat, that page in the very beginning. This affects everyone, as Claire was mentioning. I mean, I know a lot of people who had to retire in their late 50s or early 60s to take care of their loved ones. So there are a number of people who had to, exactly, thank you so much, Tamika, who had to completely give up work. 9% of people had to completely give up work. A quarter of the folks are in that sandwich generation, right? A lot of folks are moving in, so they've got to take care of the children and the parents as well. And just to be aware of this as a business, could you do what Claire's business has done and others? Could you have once a month noon support group, or even a caregiver support group, so people could gather and just kind of get it off their plate? Believe me, when you address and make sure to be aware of these caregivers' needs and give them the flexibility, perhaps in business, for example, or in hours or something, you will have better engagement, and you will have better production. So this is really talking about, it affects the entire family and the entire person, right? It's emotionally draining, it's financially draining, and of course it's physically draining as well. So just being aware of that is really, really good. And I don't know if we're going to go through all the 10 signs to look for at some point. We'll see what kind of time we have, but just to let you know that we can come into your business and teach the 10 signs so you guys can be aware as well. Now, I'm just going to really quickly switch gears and talk about a little bit about what's happening with people of color. So Blacks and African Americans are 2 times as likely to develop Alzheimer's, and Latinos, Hispanics are 1.5 times as likely to develop this disease. What we know so far about that is that a lot of those folks come forward with risk factors already, so that's why they're more likely. So some folks are pre-diabetic, for example, or have some cardiac issues. So that's what we know, and we are getting involved, and I'll share more about this in a moment, as will Claire, getting more folks involved to find out other reasons, to find out what are other risk factors that are determined based upon your race. So we're definitely looking at a lot of those different issues as well. And now I think I'm going to switch it back to Claire so she can talk a little bit about what's going on with that. Let's just mention really quickly that we had a big study that talks about discrimination is really a barrier to Alzheimer's care. And that's what we don't want to have happen. We want to fix that. So maybe I'll pass it back over to Claire to talk about that.
Thank you, Kristen. And, I've seen this in several ways, both in when you're just taking care of patients, but also when you're trying to get patients to enroll in research. And certainly one of the things we know is that we don't have good representation in research studies, sometimes of women, but also of people of color. And because of that, sometimes we don't always know if treatments will be useful for them. And this is a critically important thing for us to do. When I think back on my practice in neurology, I was in Boston in a pretty diverse population. And one of the things that you find is that patients don't necessarily trust somebody who doesn't look like them. So if somebody is coming to a doctor and the doctor is a white person and they're a person of color, they would really like to hear that from somebody who is similar to them. And I would find sometimes, for instance, when we were in the hospital and somebody came in with confusion and we thought that perhaps this was dementia and we were explaining it to them, I would leave the room and then the family would call in the nurse on the floor who was perhaps a Black nurse or an Asian American nurse and ask them to come in and to talk to them about some of it because they more would trust that person who looked like them. And so that's a significant issue that we have in healthcare. Certainly, there's more women in healthcare than there ever used to be, and there's people of color joining, but we need to make sure that we make our healthcare systems reflect the population that we're serving. Another thing is that the tests for Alzheimer's disease are not always as accurate in people of color and in people of different cultural backgrounds and educational backgrounds. One thing we talk about all the time is just the ceiling and floor effect. So if somebody, for instance, when I was in training in neurology, we had a professor of physics who came in and said he thought he was having memory problems. And no matter what test we gave him, we couldn't find those memory problems. But he was right. He was in the early stages. But, I didn't know, obscure physics questions to ask him to see how he was starting to fail. At the other end of this, if somebody has very limited education and they're starting from those limitations, finding ways to understand if they're having a decline is also difficult. So education certainly plays into this. Another thing is cultural factors. So, sometimes we'll have cognitive tests and we'll ask people to repeat certain things, but if you're asking them to repeat words that are not familiar to them, then that's not really a fair test. And so you need to understand where they're coming from, and that's really important. The other thing is understanding who should be with them, who should be the family caregivers that you're including in the appointments. So different cultures, sometimes the spouse is the most important person, sometimes it's the eldest son who's going to be making decisions. There's all sorts of other phenomena that can happen. Sometimes we'd see this in the hospital where, hospitals can have rules and they'll say, well, we can't have this many family members, people are going to have to leave. And then what you do is you exclude the person who perhaps is actually the most valuable decision maker to that patient, and that can be a problem. The other thing is language. And so certainly we understand that if somebody, speaks, say, Spanish, and we're not talking to them in Spanish, that's a problem. But I'd also say in English, we have a problem. So one of the problems we have is doctors speak medical English, and medical English is not well understood. And a common thing, even in the dementia space, is just the whole issue of, we talk about somebody having cognitive decline, and that phrase alone doesn't make sense to most people. We need to break it down, and we need to say, well, are they having some problems with remembering things? Are they forgetting words? Are they finding it harder to, use the VCR or the TV? Are they finding it hard to do things that are usual activities? The thing that, of course, is hard is that, as a doctor, when I'm talking to somebody, I don't know their personal history. So I can't say if they're remembering their personal history correctly. And I also don't know what their functional level was before they started to have some decline. And that's where family can be helpful and where we can get a good sense of things. And really, when dementia becomes a big issue for the patient and the family is when that functional piece really starts to kick in. So, people can do a lot in the earlier stages, but when they start to no longer be able to figure out how to use the usual usual kitchen things, how to get their shirt on correctly, all of that is when the bigger declines happen, and it's important to recognize that. In the research space, we see some of the same things. So, if one of the things that happens is if when my husband was going to a neurologist that he felt very comfortable with, as they started to offer him some possibilities of research, the research protocols were then going to take him away from the doctor he already knew and send him to a doctor that he didn't know. So that whole thing about trust has to be reestablished when you're asking somebody to go into a research protocol. They again meet a new doctor that may not be from their background, that they've never seen before, that may talk in a different way than the neurologist they've already been seeing. And that can be a significant barrier. Also, when you're looking at research and you're trying to recruit people for different studies, it's also important to go where they go. So sometimes people are not looking into these things when they're in the healthcare system, but they may be more appropriately approached through other community resources, such as their church or other community organizations that they're involved in. And so, if there's a gathering of folks who may be a particular Asian American group, that may be the place to go and to say, hey, we have a research study around dementia. Is anybody interested in participating? And sometimes that can even be, the people who are at risk as well as the folks who are already patients, and it's important to do that. I was also thinking about this yesterday, and one of the things that came to mind was one of the things that I suspect sometimes makes people a little nervous about research studies is when you enter a research study, they say to you, everything's going to be free. And we found in healthcare that sometimes if you say things are free, people think it's not as high quality. And, they've done studies of this in the past, and they said to folks, well, here's some pain medicine, and this one is really effective, but it costs pennies a day. And here's another one. It's sort of effective, but, it costs $10 a day. And when they ask people, everybody wants the $10 treatment because they figure that must be better. It costs more. And in our country, the Cadillac has to be better than the Hyundai. And so I wonder sometimes if for people of color, offering something that's free to them may make them even more worried that, they're not going to get the best care from this. And I think all along the way, the lack of trust in healthcare is a major issue. Another thing that happens in research studies is that you're often asked to stop a lot of the things that you're already doing. And as we know, cultures have different ways that they approach memory loss. So, in some cultures, there's certain teas that people will drink or certain supplements that they'll take. And if they're told that they have to stop those things, they will feel that as a significant loss, and they may not see the study as providing something that's even more valuable. The other thing is the difficulties of being in studies. So, when it was interesting because my husband and I had somewhat different concerns about him being in study. One of my concerns was how would I get him back and forth and how would I do all the things that way? And he didn't seem very eager to do the studies. And finally, I said to him, do you just want to say no to this and not have that question anymore? And what's bothering you about it? And the thing he said was, I cannot keep going through these tests over and over again because each time I feel bad about my memory. And so the other hard thing that we have to recognize is that for everybody, being in a research study can be a really difficult thing because it keeps reminding you that, you just don't remember things as well as you used to. And so I think that's not just a problem for people of color. It can be a problem for everybody, but it may be something we need to address differently based on your culture and your background. So, my feeling is that the important thing is we've all addressed that now, that this is clearly an issue and we have to find ways to solve it. I don't think there's going to be any one solution to how we make sure that people of color are getting treatment and are getting into research trials. I think it's going to be many different solutions, and we all have to be open to that. We also have to be open to speaking to the people in these communities and saying, where are we missing? What are we missing? What are we not doing? And how could we help you more? And I'll turn it back to Kristen to talk about some of the studies that are happening.
Perfect segue. Thank you very much, Claire. That's a lot of great information that probably people weren't thinking about. I can imagine, Garrett, I see you shaking your head when Claire was talking about a lot of these things. I mean, this is just really fascinating, looking at the cultural differences and the education differences, and you know, even what your husband was saying, how it didn't make him feel good about himself. And frankly, when you're in a place where you're lost and your brain is changing and you're not sure about where you are, sometimes not feeling good is something that should be taken out of the equation. Absolutely. So interesting in talking about, you know, some of the things that you were just mentioning. So there are a couple of studies that we're doing right now as the Alzheimer's Association that are really focusing on trying to go to people of color. And you were just mentioning, Claire, talking to people in their neighborhood where they are, going to them versus saying, hey, come to this community forum 17 miles or 25 miles from where you are. Instead, we're really working now. We have a DE&I, you know, diversity, equity, and inclusion pillar that we're really working on, focusing on, hey, can we come to your church? You know, can we come in, you know, build the relationship, and can we come into your church and talk to you there about listening to you, not talk to you, listen to you about what you need. So I think those are important, like having those kind of community forums in the places where folks, you know, what do you need from us? What can we help you with? How can we, you know, work together on this? So two studies in particular that are really, that we're funding as the Alzheimer's Association. One is called New Ideas and one is called US Pointer. So let's go back to the original Ideas study. The Ideas study was taking a look at folks. So let me back up even further. Years ago, the only way to really diagnose this disease was on autopsy, right? Because you can actually see the amyloid plaques, tau protein. These are different things, tau tangles. These are different biological terms, but those are some of the hallmarks of the changes of Alzheimer's disease. And you could see it on autopsy. Now there's a way to be able to see this in a live brain. Part of it is a PET scan. PET scans are not usually covered by insurance, but PET scans can give you a live brain visual of those changes. It's an agent that goes in and it lights up different parts of your brain to show, hey, there's those amyloid plaques that we're talking about. There are the memory changes we're talking about. The other thing is to have, excuse me, a lumbar puncture. Super invasive, more invasive, obviously, than an agent and a PET scan, which could determine the amount of levels in your blood, in your cerebral spinal fluid. So what we did is we had a study looking at, in PET scan, looking at folks who were earlier diagnosed. If in fact the PET scan showed that an earlier diagnosis would affect their care management plan, would affect how they were treated through the process of this disease. And in looking at thousands of people, they found that it did. So this is a push for, hey, wouldn't it be great if PET scans could be covered by insurance, right? So that was one study. Now we're doing a New Ideas study because that study was mostly white. So now the New Ideas is looking for people of color, getting people of color looking at their brains, because everybody gets dementia, right? It doesn't pick, choose certain cultures. It's all over. So really looking at that. So that's one issue that we're looking at to try to expand to looking at people of color as well. The other very exciting study that we're looking at right now, which we are in a recruitment phase, is called the US Pointer Study. Now, this study is not only funded, it's also run by the Alzheimer's Association in coordination with a number of different medical fields, medical agencies across the country. And this is interesting. This is coming off of the Thinker study, which is done mostly in Scandinavian countries and is now kind of spread around the world. Finger pointer, get it? And US Pointer is taking a look at 2,000 people with suboptimal lifestyles, right? So perhaps they don't get very much exercise. Perhaps they are bordering on pre-diabetic, blood sugar issues, etc., between the age of 60 and 79, and they're going to incorporate these 4 tenets. and watch them for 2 years to see if it in fact reduces their risk. And the 4 tenets are things that are really good for your heart. What's good for your heart is good for your brain. So there is an exercise component. We're pairing with YMCAs across the country. There is a diet component. We're really encouraging and teaching about the Mediterranean or mind diet, excuse me. There is the cognitive and social stimulation part. And then the fourth tenet is more regular wellness checks. So they see the doctor more often. So after these 2 years, we're going to take a look at to see how it reduces the risk, because we do know from other studies that it does. And we do know from those Scandinavian studies with mostly white people that it does reduce risk. So now in US Pointer, we are looking for a certain amount of people of color to get involved. And as Claire said, there are barriers and there's trust issues. So there's a lot that needs to be done. And we're working on all of that to make sure that we show and talk about the entire community, who has this disease versus just some of them. So just quickly, a way to get involved in clinical trials. And let me just talk about clinical trials, because I have a healthy brain as I know of right now, but there could be changes happening in my brain up to 20 years before any sort of symptoms happen. And my mother also had the disease. So I am at a greater risk in that regard. But I volunteered as a healthy brain for a clinical trial. So clinical trials can be people who are healthy, caregivers, spouses, children of, and people who they call unwell, people maybe who have this early onset, people who have MCI, which is mild cognitive impairment, or people with full-on disease. And their studies range, you guys, from literally answering a few questions on a computer once a quarter to what I did was get a couple of MRIs and answer some cognitive questions, to hopping on a treadmill, to trying out a new drug. So there are all sorts of ways to get involved, and Trial Match is our clinical trial matching service. So what you do is you put in your information, and then you get information on the trials that may be near you at Yale or at UConn Health. So just go to alz.org. Thank you, Kristen Welton, for putting that in the chat, /trial match, put in your information, and then things will pop up. Your information is never given out. So it's up to you to reach out to those different doctors and find out about those clinical trials. But that's a way to give back. And we really find that people who perhaps even during their caregiving or post-caregiving, it's good to have something to be empowered with. And so in fact, Trial Match is one of the ways that we do that. Another way is Walk to End Alzheimer's, which we can talk about for a moment. But I do know that there are some questions. I did see, Garrett, there's a question about FMLA. We could read that maybe to Claire, because I know we wanted her to speak about that a little bit.
Yeah, thanks, Kristen. So we did have a question, and we can make this a little bit more broad too, asking about how FMLA works, especially if the person that you're trying to give care for is not in the state of Connecticut or the state where you're based off of. So I know we start to get a little bit into employment law here, but Claire, I know you've had some experience with FMLA from this standpoint. So anything you could share would be helpful.
Yeah, the way I understand FMLA, it doesn't necessarily mean that you have to be, the primary caregiver living in the home, but certainly it is something that differs. There's certainly layers of federal legislation on top of state legislation on top of what your employer is doing that makes this all complex. I would say to you, all of you as employers, push this information out in detail to your employees as opposed to expecting them to come to you and ask, because one of the things that happens is when you're a caregiver, sometimes you don't want to ask the question because you're afraid somebody will figure out something's going on in your life and you're not ready to tell the story yet. And so, make sure it's on your websites, the information is clear and people can get it, because then I think that at least they'll be able to find it. And I do say this is very complicated, and I'm not a lawyer. I don't play one on TV either. So, I'll stay away from some of the details of it.
Claire and Kristen, maybe you can answer this just in general. And I know, Claire, we've talked about diagnosis and that it's difficult, especially early on. And I'm sure many people are hesitant, even if they feel like something's going on, that they want to face that. But what is the value of getting that diagnosis as early as possible?
Yeah, so I can address that, and also Kristen, if you want to add on. So one of the things that can be part of that is certainly to make sure that the person's life is structured in a way that gives them the most independence, but also provides safety. So, understanding that they may have some mild memory problems and they need to start to use some memory tricks about how they're going to go about things in life, whether that's keeping lists or doing other things like that. The other thing is to look at whether they are eligible for medications in the early stages. So there are some medications specifically for Alzheimer's disease, but the other things that I sometimes found in my practice was also to make sure that the person wasn't also dealing with depression or anxiety related to this. And often what I found was treating the depression really made a difference in their life. It's not going to be surprising to anybody here that if you're losing your memory, that with that comes a certain level of depression and anxiety, and getting people on that can be important. Also making sure that they're doing other things to keep their memory as sharp as possible. So eating well, sleeping well is a critically important thing. So if people are not sleeping, their memory is much worse and the dementia symptoms will be much worse, and looking at all of that. And then just helping the family start to get connected to the supports that they need. And Kristen, I don't know if you want to add to that.
Yeah, all those things are absolutely, and you can actually earlier diagnosis, you can make some of those lifestyle changes, right, that you may not be doing, right? You may be, and that actually kind of goes really nicely into the next question that's coming up from Sheila Maloney. But talking about, some things that you could incorporate. Maybe you do go to do a daily walk now if you're able to walk. Maybe you do try to eat a little bit better and do the salmon and the blueberries and just try to, do stuff to take care of yourself and really make sure that you're getting enough sleep. And maybe you do make those changes, and maybe you do get involved in some sort of clinical trial to either help yourself or help some folks in the future, and also to plan for your future, right? So when you get this earlier diagnosis, you can kind of know what's kind of coming up. There's no specific timeline. It's not, it's different from, like, say, a cancer diagnosis where say, well, we have probably a year to live or something like that. It's similar to cancer in that it just kind of, it picks who it picks, right? There's some genetic components, there's some environmental components, but my mother, again, no one in our family, right? My mother was the first one to have dementia. But preparing for those, having more of those special times with your family, preparing, doing, I know a family woman who was diagnosed in her late 50s, and she and her daughter did a bucket list trip, right, and drove across the country. So making those memories, making those moments. So there are a lot of things that could help in that regard.
The other thing is the ability to be able to say to family that this is going on. And if you want to have time with your loved one, now is the time to do it. You don't want somebody else in the family to feel cheated out of those quality moments. Also, as you said, Kristen, the preparing for things. I am so glad that my husband, or in the early stages, we sat down with an estate attorney and he could express all of his wishes before he had more memory problems. And so I feel very comfortable in how what things we did after he died, and that we had truly followed his wishes. And that gives the people who are left behind a real feeling of doing right by the person who died. And I do think there's so many things in the early stages that you can do. I took more vacations, I'll be honest. It was time to take more vacations and to do those sorts of things, and making sure that you figure out how to do this. I see a question about how do we get researchers to really have more empathy for non-white populations. I do
Claire,
think
actually,
that
we've got Sheila who's going to ask that question. She's
All right.
on the line right now. So go ahead, Sheila.
Okay.
Yeah, hi. No, you expressed it very nicely. I really, for researchers who want to have more empathy and who want to reach out and who want to really engage with communities of color who are living with dementia, what tips do you have for them?
There really is a lot of work that's happening. And, within my own organization, we've done a lot of multicultural training, which I think is critically important. So training the providers to ask questions in the right way. So one of the things that doctors do very poorly a lot of times is we already have a preconceived notion about how somebody should be reacting to a diagnosis and what they would want to do about it. And we need to back off on that. And we need to say to folks, okay, and we now think that you have some memory loss. We're not yet sure that it's Alzheimer's. We're in the process of working on that and helping you get a diagnosis. What are your questions and what are your goals for what we're trying to do right now? And how do you want your family to be involved? And what's your beliefs, whether they're cultural, religious, whatever it might be, that will influence how you want the course of this disease to go. So I think a lot of it is asking more questions. And like Kristen was saying, doing more listening as opposed to, our American model of healthcare is you come in, you get a diagnosis, you get a medication, you get studies, boom, boom, boom. This is the way we do it. That's not the plan we can really have for Alzheimer's disease, where there's so many parts about it that are really so embedded in your daily life and your social environment.
Another question, and Kristen, I know you touched on this just a moment, that Alzheimer's picks who it picks, and there's a genetic component to it as well. But in hearing some of the things you've been speaking about, both of you, about getting rest, pre-diabetic, some of these other risk factors, what should everyone out there who's listening right now, things that they can be doing to live a more healthy life, and for the limited factors that they can control around Alzheimer's, what are those things?
Yeah, so the things that you can't control are your age, right? That's the greatest risk factor. We're getting older, and most of the folks who are diagnosed over the age of 65. But as you heard from Claire and many people, there's a larger contingent of people who are being diagnosed below the age of 65 in their 40s and 50s. And so younger onset is definitely another whole other aspect, and introduces a whole other set of issues, including the fact that many of them are still working, right? So that's a concern as far as that's concerned. You cannot control your race, right? You cannot control your genetic makeup, but things that you can control are the things that we're talking about, good for your heart, good for your brain. You can control the amount of physical activity that you do. You can try to control your food intake and reducing the fried foods, maybe, and trying to not do as much sugar, even though we love the sugar, right? You can do things to protect your brain, your head, right? So wear your helmet when you're biking, or exercise. You can try to get some more exercise. You can increase your sleep. There was a study that came out a couple of years ago that was actually the first thing that we found that we can actually do something to reduce our risk, and that was lowering our systolic blood pressure. So 140 down to 120. So that actually showed that reduced risk of Alzheimer's disease. So now we know that there are things we can do lifestyle wise. It's a matter of incorporating them into your life, and everything in moderation, right? And doing what you can do. But it still doesn't explain why people who are marathon runners get this disease, right? I mean, that could be either part of the environmental factor, which we know about air pollution and various things, but or could be, part of the genetic factor as well. Claire, if you want to add anything to that.
Yeah, and one of the things I would piggyback on with that is that there's a lot about Alzheimer's disease that we don't understand, and whether in the future Alzheimer's disease will be one disease, or we'll find that it's several diseases, that there's different factors that lead to it, will be important. Within the health equity space, the other piece that is important is that what your environment is. Do you live in an unhealthy environment as far as air quality, other things like that? More and more we're concerned that could also put you at higher risk for Alzheimer's disease. I worked with a researcher once who actually felt that diet early in life could actually cause difficulties in the brain that may show up as Alzheimer's disease later in life. So, if you want to cast the net really broadly, we should think about making sure that all children are getting good diets, exercise, and good education, because that sets them up the best in the future to hopefully avoid Alzheimer's disease. What we find is that higher education sometimes leads to less of a risk of dementia, that those with less education are more prone to dementia. So doing things even with children can help us as a country move forward with having hopefully less dementia in the future.
That, I believe, covers all the questions we have right now. We can take more, but Kristen, I wanted to give you an opportunity to talk a little bit about the walk that is coming up in September, and it's these types of efforts that move the research forward.
Excellent. Thank you so much, Garrett. Yeah. Our walk to end Alzheimer's is our biggest fundraiser, and we're so pleased to be back in person, right? We already had one. We have 6 more to go this fall. We had one in Bristol, Connecticut last weekend. This coming weekend, we're going to be up at Lime Rock Park. trying to do them all across the state. And then in the area that a lot of the Greater New Haven folks will be interested in is our Greater New Haven Walk. New site alert, everybody. Maybe we can put that in the chat as well, Kristen Walton. Ken Strong Stadium is our site now at West Haven High School. We were finding that the Lighthouse Point Park site would get so incredibly busy that sometimes folks couldn't even get in because it's kind of a one lane in. So anyway, we're switching sites in the hopes that we can get folks there, and it would be better to get folks in time. And the good thing about this as well is that the route opens at 9 o'clock and the ceremony is at 10, and the ceremony is those flowers on top, these beautiful Promise Garden flowers, and everyone holds one up, depending upon where you are in the disease. And the thing is, to be safe and COVID safe, we're having folks you can walk before or after. So if you wanted to, you could come at 9, walk the route, and then have the ceremony and then hang out, visit the sponsors, do whatever you need to do, or you can come to the ceremony and then walk after. So we're kind of a staggered start to make sure everyone's safe, encouraging masking crowded areas. We've got hand sanitizer, spreading everybody out as much as possible. And you can also have the opportunity that if you don't feel comfortable coming, to actually walk in your neighborhood and walk with your family. But our Walks to End Alzheimer's, the money that we raise goes to all those things I was telling you about, the education classes, the support groups, the care consultations, the 800 number, and research, the research that I was mentioning as well, really pushing things forward in this field. So alz.org/walk, and I think we put it in the chat. That's to sign up and register your team. There's no minimum amount of fundraising. It's not like you have to raise a certain amount and then walk or walk per mile. It's raise money, put it on your Facebook. It's super easy to raise, and you can raise money all the way through December 31st. And then you come, and if you raise $100, you will get a shirt. By now, you probably won't get it in time for the actual walk, but you'll get it afterwards, and you get the flower. And it's just a really poignant, beautiful experience. And that weekend, on that day, Gil Simmons from News Channel 8 is our MC, and he's been doing it for a number of years. So he'll be doing that one. And then the day before, the 25th, is the New London Walk. So check out our website, alz.org/CT or alz.org/walk to find out a walk near you. There are 600 of them across the country, so there's definitely one near you. Thank you.
Well, thank you, Kristen. And we'll definitely get people out there. It's such an important topic. I want to thank you and Claire for both spending the time to share with us and with the people that we have live here, and then also anyone who's joining us on our on-demand webinars on our YouTube channel as well. And so sure you support the walk coming up. Alzheimer's, such a devastating disease that so many people deal with, and so many, as you heard today, not just the people who have it, but also the family members, people you may be working with, your employees. So please be mindful of that. Thank you again to our Healthcare and Life Science Council for putting on this programming, and we hope to join you again. We have many events upcoming, as well as our annual meeting that's going to be going on October 14th from 3 p.m. to 6 p.m. That's in person. Please, our sign up is about to go live this week, and we look forward to having you join us for that event. Have a great day, everyone. Thanks again for joining us today.
Thank you.
Thank you.